Yeah, good morning, guys. When we get our kids ready to go back to school, we have a lot of things to check off our list, not just school supplies and maybe doctor's visits, but also looking at their feet. When we take the kids to the doctor, we tend to think about other things. So Dr. Alan Discon is at Jump Street today, and we're going to tell you why we're at Jump Street in just a little bit, but you guys are offering some free foot checks for kids this Saturday. Specifically, what are you looking for? Why do we need to get our kids' feet checked before back to school?
That's correct. One of the main things we're screening for is what we call hyperpronation, and that is when your feet roll in and turn out. When that occurs, the children's knees can roll in, their hips roll in. They develop signs like growing pains or inability to do a lot of their sport activities.
Well, is this something that would be pretty obvious to parents watching their children walk around to see that, or can it be pretty subtle too?
It can be pretty subtle. Many times you'll see this malalignment when they take their shoes off, step down, and if you can see their feet roll in.
Okay, and we have a patient here, Bailey, and you said she has that problem. Show us exactly what we're talking about.
This is Bailey, and Bailey's going to stand for us, and if we see how she stands in her sandals and her shoes, her feet look pretty straight. Sweetie, would you step out of your shoes? And when she steps out of her shoes, and you can see that her feet roll inward. Her feet roll out and the ankles roll in. Sweetie, turn around one time also. And spread your feet apart a little bit. You can see how her heels turn outward. When that happens, the ankles roll in, the knees will go forward as well as the hips. Eventually, as they grow and develop, if this is unchecked, they can develop secondary problems, much like the knee problems that we're seeing arthroscopy for in their 20s and 30s, or hips when we get older.
So how do we fix this? We want to obviously nip this in the bud as soon as we realize it's a problem. What do we do? What do we do about it?
That's a very good question. What we do is we try and create an internal balance for her. Turn around, sweetheart. This is an internal problem and usually requires some form of an internal support structure.
And you actually have a model to kind of demonstrate how this would be fixed.
We do. What this is the average foot. And when a foot steps down, it normally would stand straight up like this. But when you have this hyperpronation or the weakness, it rolls inward and this joint opens up between the heel and the ankle. By using a simple device known as a HyproCure little stent, which is a wedge that fits into a naturally occurring space in the foot, it goes in there, sits, and when you push down, it supports that ankle joint. It almost immediately solves the issue.
All right, so when people come here to Jump Street in Chandler to get this checked in, how long should they expect to be here?
You know, the screening only takes about 5 minutes. We're going to ask you to stand up with your shoes, without your shoes, walk about 10 paces back and forth, and it usually will give us an idea of what we're looking at, if we can see that subtle rolling in.
And then if there is a problem, you can obviously schedule further appointments with your children's doctor. So the reason we're at Jump Street, obviously, this is where they're having the screening on Saturday. It's from 10 to 2, and you guys are throwing in a little extra for folks who come out here.
That's correct. Everyone that comes out from 10 to 2 and gets their foot screened by one of these top doctors, they'll get 1 free hour, full access to everything that Jump Street offers.
All right, it's a good payoff for kids because they never really like going to the doctor. So you get an hour of jump time either here at the Chandler location or at the Glendale location. We're at Arizona Avenue in Warner. Glendale's around 59th Avenue in Bell?
55th in Bell.
55th in Bell. So there you go. This is Saturday from 10 to 2. And of course, we'll put more information for you on our website at azfamily.com. Back to you.